Estoy con el doctor James Elist en el Hospital San Jorge en Monterrey, Nuevo León. Acabamos de poner el primer implante subcutáneo peniano, Himplant. Dr. Elist, how are you?
Thank you.
Thank you for coming here to Mexico.
Thank you
and I have a little bit question for you.
Sure.
So what is Himplant? What is Himplant?
Okay. Thank you very much for inviting, and it's my pleasure to be here in Monterrey, Mexico. Himplant is a device which originally was invented back in late 90s, and in early 2000 we got the FDA clearance, and since then it went through different changes, and Himplant is the final device. Subcutaneous prosthesis goes under the penile skin, and it does increase the girth of the penis on flaccid, girth of the penis on erection, and because of the stretching, does increase the length of the penis on flaccid, and any additional length on erection is unpredictable. So it's a subcutaneous penile implant which does increase the girth and length, correct any kind of curvature or any kind of problems that the patient have with the size of their penis, retraction of their penis. If the patient has a retractile penis, that penis goes inside. If it stretches penis, it comes out, okay? And any kind of cosmetic correction of the penis, as well as curvature of the penis, or any other difficulty that they have with the size and shape of their penis.
Okay. Acabamos de tener una jornada intensa de muchos pacientes que operamos con este dispositivo. Realmente los resultados son espectaculares. Dr. Elist, what does Himplant change life in the life of the man?
Okay. Some men, I cannot say most, but a lot of men, they have problems with their self-confidence and their self-esteem, with the size of their penis. They feel that their penis is narrow or their penis retracts. They feel very uncomfortable. I have many patients, they come and they feel very uncomfortable. They go to the gym because their penises start to retract, so they feel uncomfortable. They have to wear a towel. Or sometimes they stand in front of their partner and they feel very uncomfortable because their penis is retracted, is small. Sometimes it has the curvature or any kind of cosmetic deformity. Himplant has changed the life of many, many thousands of men by changing the size. And that one gives them, some self-confidence and self-esteem. That's what we try to bring to the world. For the men, that they feel very uncomfortable about their size, their shape of their penis in front of the partner. Or we have some people that have been insulted. Some of the men, that we do the surgery, they say childhood, have been insulted, by their parents or by siblings, that your size is so small, what can you do with that, okay? And we change it. So their life has been changed to better by changing the size of their penis, okay? So that's what our goal, and that's our mission international, and that's the reason we are here with you.
Thank you so much. Dr. Elist, actualmente este dispositivo está autorizado por la FDA y por COFEPRIS. I want to ask about what is the difference of the fillers, on the injection, on the metacrilatic, of this kind of stuff that the patient come with me and have a disaster in his genitals. That is disaster for the many patients. Muchos pacientes vienen conmigo por desastres que les inyectan cosas en los genitales, ácido hialurónico, grasa. What is your opinion? ¿Cuál es tu opinión ante esto?
Okay, that's a very good question. Originally, back in late 2000, when I came with the idea of the Himplant, which was PENUMA, but now is Himplant at that time, it was because I saw many men that years ago, 20, 30 years ago, it was very common just to do the fat injection. So these men were coming to me with a fat injection, and all of them were deformed. They have bubbles, they have deformed penis, they have different shapes. They were very unhappy, with the size of their penis, okay? Later on, they went with alloderm. Later on, they went with dermal graft. All of them, they had problem, infections, and their deformity on their penis total. So I felt very bad for them. That's the reason at that time I came with something which is fixed shape of the penis continuously. You can repeat whatever we have, and of course, is FDA clear. So that's very, very important for us. Okay. Now we see that people start to do the fillers and gel and silicone. First of all, none of them increase the length of the penis. If they give them a bulk, but it's temporarily, because all these fillers, they're partly water, okay, and then they have other material like a silicone. And the water absorbs, they start to just shrink and goes back and form the lumps and nodules in the penis. And when they start to, after a few days, the weight of the filler start to go down lower and lower and deform the shape of the penis, become like a trunk of elephant, okay? That's what happens, okay? We saw many patients, unfortunately, they came to us and they say, I made a mistake, I want to remove it. So we can't do anything about that. Because if you remove that one, your skin already been insulted and damaged, and we cannot put the implant for them. So we do not recommend implant at all for the patients that they put something under their skin, because their skin already been insulted and had difficulty of the vascularity, the vessels and the blood flow has decreased. If you put it there, they're not going to survive that one. So we highly recommend, don't do it. It is temporarily. You have to go back every few months, do another injection, and that makes it worse. The cost is much compared to implant. This is one time the surgery, you do that. And if you do the surgery in a few years, it's up for upgrade. In implant also, sometimes we do the surgery, but we do it to make it bigger.
Yes, of course. That's the reason why is.
That's right. That's the reason we do that. Okay, but with the gel, you have to do it continuously, and all this starts to absorb and form lumps and bumps and deform the penis. So we do not recommend it at all for the patients.
Okay, well, thank you so much, Dr. Elist, for your teaching to me, for come to Mexico, for all your knowledge, and thank you so much.
Thank you very much. Thank you, I congratulate you. You're the first, Dr. Carlos Guerra is the first urologist in Mexico who performed implant, and we are really proud of you, and we congratulate you.
Thank you so
very
much.
much.
Thank you.
Thank you.